couldn't even say the word at first. Couldn't even say the word cancer. I called it the C word.
The diagnosis was stage 4 adenocarcinoma of the lung. I don't smoke, so that was a shock.
Cancer rates have increased in West Virginia over the past several years at a disturbing pace, with incidence rates that are higher than the national average.
Obviously, cancer is an important medical problem. In the next 10 years, it will overtake heart disease as the most common cause of death in adults over the age of 50.
Nationwide, men now have a 1 in 2 chance of developing cancer, and women have a 1 in 3 chance.
And I couldn't believe that I had cancer because I was active and healthy.
But I had a spot in my liver, a spot on the base of my skull, in addition to involved nodes and the tumor on the lung.
It was early stage 3 cancer.
Biggest concern was just fear of me dying and leaving behind a husband and 2 kids.
Who will offer these cancer patients hope and healing? With your help, Charleston Area Medical Center and the CAMC Foundation will build a modern, comprehensive, state-of-the-art facility for the treatment of cancer. The new Cancer Center at CAMC will be more than a world-class treatment center. It will be a testimonial to the power of many. That power was celebrated recently when CAMC employees and supporters of the Cancer Center campaign outlined the site of the future 100,000 square foot facility.
The goal is $15 million for the Cancer Center. And we kicked that goal off in the most wonderful fashion, and that was with the employees of the hospital. The employees of the hospital have pledged over $500,000 to this campaign, and I want to thank every one of them for what they have done.
Along with campaign directors, CAMC officials, and CAMC oncologists, patients of the current David Lee Cancer Center participated in the celebration too.
Today is a celebration of an enormous effort so far to raise money for the new Cancer Center.
And while patients exclaim over the wonderful care and treatment they've received at the CAMC David Lee Cancer Center, they are realistic about the current facility's limitations.
It's an excellent place to heal. It's a little cramped and crowded, but it's an excellent place to heal.
They just come to our cancer center and see the crowded rooms, the waiting room, the waiting times, and they'll know why we need a new cancer center. I think the new cancer center will lead to multidisciplinary care. That's it.
Care that's accessible and convenient.
When Dr. Jubileer said we can do this treatment here, I could not have been given better news. If you have a state-of-the-art facility, you can only add to the excellent staff that we already have here. And what an advantage for patients to walk in that building, and all the services that they need are going to be right there.
If we have a cancer center that's roomy and spacious, serene and peaceful, with everything we need right there in one location, the healing would begin before the first chemo or radiation treatment. The healing would begin the moment we walk through the door.
Spacious, serene, and peaceful are just part of what's planned for the future Cancer Center at CAMC. The new center will include CAMC's breast center, 36 chemotherapy treatment bays, radiation therapy, pharmacy and lab, patient and family waiting areas, a coffee shop, conference rooms, a healing garden, wig and prosthesis shop, garden terrace, and tumor registry. All within easy access for patients from around the state and neighboring states as well.
This is where my network is, and it would have been a whole lot tougher had I had to leave the state to get treatment. And because I really do think that's what helps people heal the quickest, is being around family and friends and support while you're getting, state-of-the-art treatment.
This is the hard part of the campaign. This is when we do the community, and we get the $5 and the $3 and the $10,000 and the $50,000.
And this is how the community demonstrates the magnificent power of many to care for neighbors, friends, and family. The need is clear. The need is now. We need your help to reach our goal.
I'm going to have a top-notch, first-class cancer center here in Charleston, West Virginia. Bravo, folks.